that we can start to redefine a story without knowing exactly where it's going to take us.
Can I ask you a question about that, Laura, just because it piqued my interest there, about these two characters in a way, and I do think a lot in characters, in a sense, younger Laura, 23, 25-year-old Laura, and Laura now, in this different position in your life, both true.
Yeah.
The younger one hasn't exactly gone away, but there have been changes, however we like to think about it. And do you get interested in both now, or are you more interested in this one here, sitting here?
Is part of what's happening. I actually feel a fluttering in my chest as well.
Yeah.
And I suspect it's to do with this younger part of me that was very tethered, ungrounded, lost. And to tell, I guess, a very brief background, I was a primary teacher. I was very stressed and I got very sick and had a brain aneurysm and a stroke at 23. And so my life changed so dramatically just one day. And as I speak about it, I can feel the discombobulation of it. I feel that 23-year-old part of me and I feel some sadness too that was suddenly so lost. And actually I was already lost, but I was now so lost. Yeah.
And it brings a little emotion.
Yeah.
Yeah.
Yeah, I was so... I had been lost but kind of hanging by a thread, and then I was raised to the ground just very suddenly.
Yeah.
Yeah, I feel there's a sadness, there's a fear and a sadness.
And where do you feel that right now?
I think in my chest and my jaw, maybe my eyes a little bit. Yeah. Sort of most probably more so my chest, a tightness, almost a pain.
Laura, if we stayed with that a little bit longer, if you're up for pausing in that space, and just notice what is that tightness? What is, you've talked about this relationship to your jaw and your chest. There's some emotion. Can you describe a little bit of that experience that you're having?
Actually, when I drop down into it a little, I just get like a feeling of being really sad and an image of me just bawling my eyes out, like just crying. Yeah.
And there's the tears there.
Yeah.
Wow, big feelings.
Yeah, like really like sobbing, crying, that kind of image of me. And I don't even know that it was about being sick. I think it's just where I was at in general.
Yeah.
Like
This
that being sick was just sort of another bad thing or another thing that I didn't know what to do with. Yeah.
I'm just going to check in a little bit, Laura, because these are really big histories that you're talking about, by the look of it and the feel of it. And at the beginning of our session, you did a very beautiful grounding exercise where you could feel your feet and you noticed where you were and you helped us breathe. And I just want to say, when you're sitting there with me now, I'm here and I'm here with you. I'm very happy to go into that experience. But just whenever you want, you are welcome to just, whatever it is, whether it's you grounding into your chair or a breath, we can just take a breath so that we've got Laura here on board as well. And I mean here by grown-up Gestalt mother.
Yeah.
Laura, just so that we can hold this young one who was in a place in her life, by the sound of it, that was very big and untethered you. So 1 foot in the tether, 2 feet in the tether, and then going back. Does that sound okay?
Yeah.
Yeah. Okay. So let's just take a big breath together, if that's good, and feel ourselves right here and now in these wonderful chairs in Jordan's studio. And then when you're ready, did something just come up? Yeah, sorry.
Just this compassion and love that present day me feels for younger me.
Oh, I can feel that too.
You were so lost. It's okay.
Mm.
I'm not lost anymore.
It's okay.
Yeah.
Not lost anymore. But back then, so much love to that one.
Yeah.
Do you think she needed to hear something?
Yeah.
Yeah. She needed to feel like something like, hang in there, it's going to be okay later.
Yeah.
This is part of something important. Something like that.
Yeah, something important is happening here, not just something bad.
Yeah.
Something important is happening.
Yeah.
And it's hard.
It's hard.
But it's not just a bad thing.
Okay. Yeah.
Yeah.
And you know that now, but back then you might not have known that.
No.
And you might not have been able to look at what was around you, what was going on, what you were striving for. It's a big time becoming an adult, hey?
Yeah.
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 Where were you actually? Where was your place? Where were you living?
I was living in Ascot Vale and teaching in Glenroy in Melbourne, and suddenly felt like my home was hospitals for 3 months, and then returning back to my home and my life as a different person in some way. And I didn't know in what way.
Yeah.
I assumed in a worse way. Yeah.
So there's that story. This is bad, and this is worse than it was before. It's very strong because, of course, the truth is you would have stopped working. It would have compromised your body, I'm assuming. Yeah. And did you need to call out for support to people? What kind of people supported you around that time?
My family were amazing. They took turns sleeping in the chair in the hospital room for weeks because I didn't want to be by myself.
Oh, that's pretty beautiful.
It's lovely.
They had a little roster?
Yeah.
Wow.
Until the nurses said, this is ridiculous. Stop.
Nurses hadn't been trained in relational healing empathy. Eh? They stopped you, but you got a few weeks of that family being with you. Your mum and your sisters and your I remember you told me before you had sisters. So
And obviously, the hospital staff were really wonderful. I'll never not be in love with nurses.
Oh, Laura. What kind of qualities that the care and the value of looking after?
Just so gentle and funny and obliging and caring. Yeah. And I also received cards, like hundreds of cards. Oh. So I guess it was pre-Facebook, so people actually sent a card, Oh. It was just so nice. Yeah. It's being from the country, I think, means that you...
So you're in community.
Yeah, you know a lot of people. And
any card that you remember particularly?
I think one from my old primary school principal, just that, I hadn't seen him for...
From when you were little?
Yeah.
So it reached across to a lot of people, your vulnerability, the big thing that had happened.
Yeah.
A lot of people heard about it and came in to support you. Oh, that's very touching.
Yeah.
Isn't it?
Yeah.
Oh, that touches me very deeply.
It's really special.
Yeah. And those qualities, those caring qualities were part of the fabric of where you grew up and your family, clearly. And actually culturally, medicine, even though eventually they were like, this is ridiculous. So there's a lot of support wrapped around you.
Yeah, a huge amount. Yeah.
And I'm just really curious about coming back to the here and now, to this wonderful professional woman who's before me. Like, what has any of that translated across? Is that the kind of value and principle and practice that you also show to people?
Yeah, I think it gave me a sense of how impactful it is to just care about what's happening to other people. Yeah. And I'd like to think that in my community I can extend some of that care that I received and just some of the support that I generally have from my family, and I have beautiful friends that kind of fills me up to an extent where then I can give some of that to other people.
It's very warm. It was beautiful watching you bring your hands in at that moment.
Yeah.
And there's also something that you said earlier on about sending care and compassion and love back in time across those years, back to younger Laura, who's having those big experiences, which are, I mean, it sounds huge to be in hospital that long and change everything, and very scary, I'm imagining too.
Yeah.
And what just came to mind was like if you were going to write a card back to Laura, one of those cards back to her, or a letter, or send her something. So you can just sit in that. Would you be up for that?
Yeah.
So sitting, you're welcome to speak about it, but you're also welcome to just feel that. Feel what that gives. That kind of nourishment of support and care. And also seeing her, Laura.
Yeah.
You've described her richly with your tears and your story.
I think I would like to say to her, and when I say her, I see all of these different versions. The stressed one before I got sick, and the one that woke up in hospital, and the one that was stuck in hospital, and the one who was having to learn how to walk again in rehab hospital for ages. And so all of these me's of that time. But I guess I want to say that she's not alone, and that though this is so hard, it's not all bad, and that what I build from here is more than, it's so many things, but it's like it's nice to be me. Life is lovely. What comes out of this experience is a really solid understanding of myself and sense of myself that I don't think would have been possible had I not been kind of raised to the ground in the way that I was. I think I could have just kept trying to limp through, but this is actually better.
Wow. So being raised to the ground actually had a benefit in some peculiar, strange way that you can see now and feel. What a remarkable story, and what a remarkable person that I meet in both that younger one and you now. Yeah, they are linked.
Yeah. Yeah, she was very fierce, and she, when the doctors said, this is how you'll walk, and demonstrated a huge limp, there was part of me that went,
Yeah, I can feel that fierceness.
no way.
Yeah.
That is not how I will walk. And she did. I think of her as, oh, poor younger me who was so stressed and then got really sick. But actually she was very fierce.
She was fierce. She knew something more. She was willful by the sound of it in a really strong way. Yeah. And in the community of people who also just knew what to do, knew how to come to you and support you. Yeah, wow. It's a really, really strong story. Yeah.